Okay, good afternoon. I think we are all on board, and in the mode we just changed from the preparation mode with the speakers and moderators to the full mode where our guests who are going to watch this session are also in there, and I'm happy to see a lot of participants here. My name is Achim Hörauf. I'm from Bonn, as you see in the background. I'm head and chair of the Institute of Microbiology, Immunology and Parasitology, and I'm an addict to NTD research and control. And therefore, I'm also speaker of the German network to fight NTDs, the NTDs, who is together with Uni Tübingen hosting this session this afternoon. We will focus our activities, and maybe you can, Annette, just share your screen and get on to the first slide for me to enable showing you the agenda. I may lost a minute. This is Carsten Köhler, by the way. Oh, here we go. Okay, if you go into presentation mode, please. Thank you. So our workshop is entitled The Challenges of the COVID-19 Crisis and NTDs. And I hope you'll also get to collect some opportunities behind all the shortcomings and downsides of the COVID-19 crisis that has led to a lot of changes in the agenda of how NTDs are to be controlled. Maybe we can at the end also discuss some of the opportunities that may also arise from the crisis, like more networking, more digitalization, and so on. So my co-chair is Dr. Carsten Köhler, as I said, from University Hospital Tübingen, and we have 5 distinguished speakers. We'll start with a keynote by Dr. Molecele Malecella. She is head of the NTD program at WHO Geneva. And we have another range of 4 distinguished speakers that we are going to announce as we move on. I think I hand over to Carsten for some technical comments, and then we go right into the first keynote by Molecele Malecella.
Yes, thank you very much. Also a warm welcome from me here from the southern part of Germany, wherever you are watching now our session. The first time forever that the World Health Summit is for 100% digital, and also it's now a try to have this workshop. Officially, it's called a workshop held digital. So as I always saying, because it's a workshop, our idea is that we have now more or less 60 minutes where the presentations will follow, and then at least that there will be 30 minutes for your questions and for the discussions. And for the questions, as we are so many, we cannot put up the speakers, but you may write your questions into this chat room where there are questions and answers, and then we will summarize and we will then direct your questions, and you allowed them to write them in from now on in the last half an hour to the speakers. So hopefully this will work. I experienced already some other workshops today, and everything was very nice. So, and I have to say before we are starting that I'm also very happy that I'm here in the southern part and not in Berlin yet, watching yesterday's TV and see many demonstrants just in front of the World Health Summit building demonstrating not to wear masks. I'm really frightened to see these people. So hopefully it's safer now that everyone is in its place and we are coming together virtually. So I wish our running now a good mute and hand over to Achim now to introduce or to give the floor to Muelle. Thank you.
Yeah, thank you. This is what I will do in a minute. Just for you internally, for those who have not been in one of the sessions, when you can, at all time you can put down and write a question. I don't know whether you will see it or the other participants, they may not see it, but us as the moderators and the speakers will see it, and we will work off this list as time goes. So my first guest, our first guest is, as said already, is Dr. Muele Malicella, head of NTD, the Department of NTD Control at WHO. And she has, of course, a lot to say of how the crisis impacted on NTD and what were some interim and also the long-term solutions, how to deal with it. I think I'll just hand over the floor to you, Muele, and thank you for joining us, and we're looking for your talk.
Thank you very much. Thank you very much, Akim, for the opportunity, and thank you to the organizers. Good morning, good afternoon, and good evening, everyone. And I'm very happy to be here to speak on the impact of the COVID-19 pandemic on NTD programs and activities and WHO's response. We are living in really tumultuous times. We're living in difficult times when it truly is amazing how the world has just in 11 months completely changed. And the NTD programs have been really impacted by these changes. And I'd like to tell you a little bit about what we have been doing and how we see the way forward. So the COVID-19 has, of course, had several impacts, but I'd like to focus on 4. First of all, the mass treatment campaigns have been affected, the active case finding and other community-based interventions. There's been an impact on, negative impact on diagnosis, treatment, morbidity management, disability prevention, and other services. We've had issues with monitoring and evaluation activities, and also manufacture, shipment, transport, and deliveries of medicines and consumables. So just to go in a little deeper to one case study, which is the COVID-19 disruption to supply chain. So what we saw was there's a reduced workforce, shifts in production to respond to COVID-19 supply needs, which of course is understandable. We found administrative delays, reduced freight movement and border crossings, as well as road transport, and limited storage facilities. And you can see this in this WER paper, which has just recently been published. In April, when the SPEN program of WHO Afro did an impact survey, they found that 26 countries postponed their MDAs, 12 countries had drugs and supplies expired or expiring, and 24 countries postponed disease-specific surveys, and about 17 countries were not providing care for LF and trachoma patients. And this was quite, if you look at the scale of NTD, this was quite a considerable disruption given the way our programs work. When we look at we had a modeling exercise which looked at the impact of COVID on NTD transmission and programs. We find that, of course, as you can see, the longer, so the first one is 6 months, B is 6 months, 1 year, and then 18 months. You see that at 6 months, the problems are not so considerable. But when you get to 1 year, you find severe need, a really important need for looking at remedial measures and remedial strategies, specifically for onco, schisto, and trachoma. And we see this at 12 months and 18 months as well. So WHO's response, of course, has been in 3 areas. First of all, normative, leadership, and operational. So normative has been the technical guidance that we've been issuing. Leadership has been remote support to countries. And then we use this time to really reinforce advocacy through our webinars, focusing on the roadmap, on the NTD roadmap 2021-2030. And our operational response has been around focusing on manufacturers and on manufacturers and others who are dealing particularly with the supply chain. So the guidance we gave on the 1st of April 2020 was about postponing the activities, but continuing essential services and repurposing NTD platforms to support the COVID response. And then we had two joint pieces of guidance that came from several departments working on community-based interventions. And in that, we had a chapter on adaptation of community-based NTD interventions. And then in the essential, and this was also joined with the International Federation of the Red Cross and UNICEF. And then we had another piece of guidance which was talked about essential health services, and this was focusing on case management of patients. But these two were joined with other programs within WHO. And then finally, we gave the green light to safely restart mass treatment activities, active case finding and population-based surveys, but of course with risk-benefit analysis. And the idea was a two-stepped approach. First of all, the risk-benefit assessment to guide decisions, and then a precautionary measures to decrease the risk of COVID-19. And another example again from WHO Afro, we saw that there was a resumption in mass treatments for NTDs, and particularly around August, September, and October, and some plans for November. So we can see that countries have started resuming the mass treatment for NTDs, which is good news on our side. And this is just for Africa, but there are several other regions are doing the same. And this is just a flow chart to show what are we saying in terms of resumption. Do the benefits exceed the risk? Look at the precautionary measures and either implement the planned activities or go back and postpone the activities until we're sure that the risk benefits are clearer. There has been great innovation in the time of COVID-19. And this is a Katori bowl, a utensil that's normally used in the household, that's now being used for MDA in Jharkhand. And so this is some of the great ideas that are coming out. In the interest of time, couldn't show many of them, but there are lots of innovations from countries that are coming out in this time of COVID, and that we'll probably use for a while now for our NTD programs. So just to end my presentation, I find that the roadmap now is more important than ever before. Because when you look at all the things that the roadmap is stating, the importance of integration, the importance of mainstreaming into the health system, the importance of country ownership, we find these are all related with recovery also from COVID. And so I feel that the roadmap has a really, really strong, is really important, is relevant, and is strong in our move towards recovery. So it has ties with the UHC and Sustainable Development goals. It seeks to promote resilience, health system strengthening, equity, and country ownership. And so moving forward, most of the shifts, the ideas that we have in the roadmap can really help us address and help NTD programs address the COVID-19 gap. And we have seen this starting in many places, and it's very encouraging that really although the roadmap was created before this happened, we see its relevance as we move forward, particularly in this post-COVID area. So thank you very much, and I'll be happy to have a discussion later on. Thank you.
Thank you very much, Meli, for this first talk and the keynote. So this, in a way, sets the scene and also directs, of course, some questions. While we shift to the next presentation, maybe allow me one question, which is really owed to the actual theme here in Europe, where we experience now in almost every country a second wave with exponential growth. In the light of this, I would still think Africa is doing better, and maybe many other regions are also doing better. So are there some latest minute changes to the agenda, and are there some thresholds from which onwards there is a guidance or recommendation to postpone again, or is that just up to the countries to decide themselves according to their capabilities?
So for now, a lot of it is risk-benefit analysis, and we're helping countries really work on the risk-benefit analysis to make sure that that they have done a good risk, a good analysis, and also to ensure that those precautionary measures are in place. Because I think the key thing is once you've done the analysis, if you don't have precautionary measures, then you shouldn't take that step. So a lot of it right now is left really in the hands of countries. And I think if the epidemiological situation changes in a country, then that is will be also part of that risk-benefit analysis. So a lot of it is country by country, and we will look to see worldwide, we look at trends and see whether or not for the NTD programs, we need to go back to April 1st. Again, I hope not. I hope we can still continue with our stance of July 27.
Thank you very much for this first answering of a pressing question. So I think I hand over to Carsten to announce our second speaker, please.
Yeah, Muele, thank you very much. Achim, also thank you. Before announcing our next speaker, I just wanted to state, as I've seen that the numbers of participants just is increasing, that you can, during the whole session, write your questions within the chat, and then we will direct your questions after all the talks directly to the speaker. Thank you for this. And also, by the way,
you might want to indicate to which speaker you address your questions, if there is any specifics. And the general ones we just transfer to the general speaker, round of speakers.
And as I also didn't mention it in the beginning, I just want to let you know, as many of you know, that there are quite many hosts of this session today. It's at the first German network against neglected tropical diseases, as you know, and also the Association of Research-Based Pharmaceutical Companies, VFR, University of Tübingen, University Clinics of Tübingen, and also the German Society for Tropical Medicine, Travel Medicine, and Global Health, where I'm the head of at the moment. So very welcome also from these organizations. So, and now I'm very happy that I can announce Constanze Böning. I think she's at the moment in Berlin. So because she's sitting there, she's staying there. She's desk officer, Humanitarian Aid and Development Cooperation with organizations Vétérinaires Sans Frontières Germany, Tierärzte ohne Grenzen. And she has a degree in international business and cultural studies from the University of Passau, very nice town, by the way, and a postgraduate master in peace and security studies. And yeah, she is interested and has experience in work experience in the context of conflicts. And also a topic which is very important for her is the One Health approach. Maybe she will also say to this topic something more. So Constanze, good to have you with us, and the floor is yours.
Thank you very much, Dr. Köhler, for this nice introduction. Yes, and thank you very much, Dr. Malechela, for this very insightful presentation on how WHO's engagement in the fight of NTDs is currently happening, and the challenges and opportunities that COVID-19 has presented to all of us. And yes, I'm interested in One Health, and it is actually the topic of my presentation. One Health, an approach to complex health problems in from NTDs to COVID-19. Next slide, please. And yeah, especially for our work, Vétérinaires Sans Frontières in the field of East Africa has proven to be a very effective and useful approach, as it is. Well, let's start with the definition, as it is as a collaborative, multisectoral and transdisciplinary approach at local, regional, national and global level to achieve optimal health and well-being outcomes, recognizing the interconnections between people, animals, plants and their shared environment. So this as a general paradigm to our work, to the approach, calls for collaboration with other actors that all contribute together to improvement in health, not only of humans, but also of animals and the environment in general. And different disciplines are being brought together in order to jointly make an effort towards improving health and well-being. Veterinary medicine, human medicine, but also social science and engineering. And next slide, please. Just very briefly, it has found its way in the NTD roadmap, as Dr. Malechela already mentioned. The previous one already mentioned vector and intermediary host control, veterinary public health as important at the human and animal interface. Provision of safe water, sanitation, hygiene, so integration of WASH actors also was in the old roadmap, and it was renewed in the new roadmap as well. Next slide, please. I'm very quickly going through this. One Health, now explicitly mentioned as a concept and approach, is mentioned a lot in the new roadmap. Collaboration is underlined multiple times. Different actors spelled out explicitly what role they can play, and in order to prevent or to control NTDs and eventually eradicating NTDs. So this was to make a point that this One Health approach and concept is very important, and I would like to briefly touch upon why that is and explain a bit the background. Next slide, please. And that is because 60% of all existing infectious diseases, they are zoonotic. That means they're transmissible between vertebrate animals and humans. And also, all NTDs are infectious diseases, except for snake bites, and more than half are zoonotic. And 75% of all emerging infectious diseases, like Ebola, but also HIV and the influenzas, have an animal origin. And now the COVID-19 comes into play, because my argument would be that it might have also accelerated the relevance or the awareness about, for the One Health approach. COVID-19 very likely also has origin in animals, in bats, but this is the latest what we know of it, and the first infections seem to be related to live animal markets in China. So there again, a link there, and the One Health approach acknowledges that humans live in a shared environment. No, please say that, thank you. No, just go back again, one slide. Yeah, they acknowledge, acknowledges the interconnectedness there, and that humans, we live in close connection to the animals that surround us, to the ecosystems, and the services, we are making use of the services the ecosystem provides us, like clean air and water. And One Health also recognizes, or is a very effective tool or approach to build resilience, especially when preparing for stresses like COVID-19 is one, but also there are others that are recurrent, that are climate change related, like the droughts that we see more frequently. One Health emphasizes prevention of infections in humans. And by looking what surrounds humans, animals, the environment, and that's especially key for diseases that have no remedy yet, like COVID-19, or in poor and marginalized settings like the NTDs, which are poverty associated. And it might provide more cost-effective measures. And with that comes a broader coverage, because the less medical or preventive measure costs, the more people can benefit from it. Next slide, please, now. And there, the opportunity, or like what we see with the pandemic, I mean, the concept has already had momentum before that, but with the COVID-19 pandemic, the attention for the One Health approach has soared. In an accelerated manner, the One Health finds its way into policies and strategies. For example, the NTD roadmap names it now explicitly, maybe not directly linked to COVID-19, but possibly also accelerated. And in the German context, the global health strategy of the German federal government names One Health as an important strategy. Strategic partnerships are being formed, or those who existed already, they gain momentum or intensify their cooperation, like the tripartite WHO, FAO, and OIE, or the NTD network, for example, and other developments that we see. Next slide, please. But when coming back to to the NTDs, combating the NTDs, or with regard to NTDs, the One Health approach offers, like, of course, always in addition to human-centered medical interventions, preventive measures like interventions to protect the environment, nature, and ecosystems, veterinary interventions, socioeconomic development, vector control, better access to water, improved hygiene and sanitation, awareness raising, information sharing, and last but not least, but strengthening the health system in general, and so that we achieve universal health coverage, all like recognizing the paradigms that One Health brings about. The ones that I've marked red here are the interventions or strategies that intersect COVID-19 and many NTDs under the One Health frameworks. They both, for both, it helps slowing down the spread. Interventions to protect environment at this, go back again, at this point in time is not an effective measure to slow down the spread of COVID-19, but it might have prevented COVID from emerging in the first place. And hopefully in the future, it might, or there's the hope, prevent the emergence of further diseases, infectious diseases. And the universal health coverage, that's an aim not only under the One Health concept, might have gained momentum, or the awareness of the importance that medical services need to be made available for everyone might have increased now with the pandemic and everyone affected worldwide. So that's the hope there from my side, and maybe an opportunity that I wanted to state. And last but not least, I would like to show a few examples of what Visit Germany, my organization, did in the eye of the COVID pandemic in our countries. Next slide, please. Of course, as always, we responded to the needs that we saw, and very crucially, information was needed and awareness raising on how to protect against the infection that made available. We improved wash, meaning access to water and soap and other measures that allowed for better hygiene. For those who had already suffered economic problems, we made cash available. And there also we observed two positive developments. First was that, and Dr. Malecela mentioned it already, community-based operations and ownership increased, because also our staff couldn't move much, so we had to involve the communities much more remotely, and they stepped up and got involved more actively and took over many crucial activities. And the other one, cash distribution, works very well via mobile-based money transfer systems. And this might be a trend towards digitalization also in other sectors, including health, the sector, that might be useful in other areas as well. And just to mention that, now that we could move again a bit more, we integrated our activities in NTD interventions that we have already going on, like babies vaccinations and parasite control measures on vaccinations. Yeah, that we can add value to our activities as well, while helping control the spread of the virus in our project areas. And with that, I close my presentation. And well, thank you very much for the opportunity to speak here. And I'm happy to answer any questions that you might have.
Constanze, thank you very much for this One Health main topic, which is very important. So the questions, please put in the chat. And after all presentations, then we will direct the questions to the speakers. So now I hand over again to Achim.
Yeah, thank you. Also, thank you for the talk. Our next talk will shed light on the situation from the East African perspective. I'm happy to announce Dr. Irene Ayakaka. She is with the DAHW, as you may know, the German Leprosy Relief Association based in Uganda, but she's also the medical coordinator for the East African region of the activities of this NGO. And as you may know, the NTDs are in some way and distinguished in those who can be addressed by mass chemotherapy, by mass drug administration or MDA, and others that are primarily manageable through active case management. And obviously, case management is also something that is impaired by the COVID-19 pandemic. Thank you for joining us, Dr. Irene, and we are looking forward to your talk.
Thank you very much for that wonderful introduction. I'm very honored to be part of the presenters this afternoon. As mentioned, I'll be dwelling on the effects of COVID on leprosy, and in particular, case finding, case management, and some of the challenges in 3 East African countries. Next slide, please. Leprosy is an NTD that is the leading cause of disability and peripheral neuropathy, if you're talking about communicable diseases. It is highly stigmatizing. It is highly stigmatized, and that results from the fact that the deformities from leprosy, especially if it's diagnosed late, and the skin deformities or changes during an episode of leprosy are very clear. They are very visible for people to see. And so patients are usually stigmatized. And the disability here, we are referring to impairment in activity, restrictions in participation that really affect a patient's life. So stigma and discrimination often lead to mental health challenges, among other challenges that the patients are faced with. And when we look at management, it ideally requires holistic approaches, full integration into the health system for prevention and to prevent transmission, but also to achieve adequate care across the continuum of care, that is from detection to rehabilitation of both physical and mental challenges that patients might face, as well as addressing the social determinants of the disease. And so it calls for a really multi-sectoral approach to this within the health system. Next slide, please. In the context of COVID-19, the health systems we are talking about here are already burdened, and yet they had to be repurposed to respond to the pandemic. So like the previous speakers have said, human resource and physical infrastructure to respond to the pandemic, and yet we have to continue with other diseases like the NTDs. The 3 countries represented here, each responded as individual countries in terms of how they responded to COVID, and so they have different experiences, however, and different responses. But for the NTD patients, and here mainly for leprosy patients, the effects were similar. The patients are already marginalized, and so during this period, they experienced even more social, economic, and mental health challenges due to COVID. So next slide. So what did it look like in these 3 countries? I have highlighted, well, you might be able to make out Ethiopia, Uganda, Tanzania, the Horn of Africa, and the East African region. For case finding, activities for a while were suspended. The number of leprosy patients, therefore, who could be diagnosed during this time, reduced. With a reduction in case finding activities, patients are more likely to experience delayed diagnosis. Next slide, please. So if you look at the case of Ethiopia, the quarter prior to the COVID lockdown, and you compare with the numbers found during the period, during the COVID lockdown, you see, or they reported, the National Leprosy Program, a 30% decrease in case finding. The same happened to Tanzania, and in Tanzania, we looked at a similar period last year compared to this period during the COVID lockdown, again, a 30% decrease. And in Uganda, the COVID-19 period just served to make our already bad situation worse. in terms of case finding, cause activities were suspended, and there was a lot of changes that meant that we couldn't find patients easily. Next slide. So there were disruptions in case management. They disrupted access to healthcare. There were reduced interactions with health workers. First and foremost, due to the fear of COVID, the sometimes poor availability of personal protective equipment, and then patients had no way of feeding back into the health system what they were going through, especially when it came to things like the multi-drug therapy that is used for leprosy. Next slide. With the COVID-19 lockdown, there were several social and economic activities that were impacted. Vulnerable populations like the leprosy patients lost their livelihoods. So for example, when in Uganda, food rations to help mitigate these economic activities were handed out, many vulnerable people, including leprosy patients, reported that they were not reached, especially in the rural areas. So slide 8. But also we have to think of the fact that many of the patients in this category have no access to health insurance, and in areas where there's no universal health coverage, it really is a challenge. Generally speaking, mental health services are hard to access in our health systems in this context, although that is improving. And COVID-19 added to the stress to both patients and health workers. So, but in terms of psychosocial support for stigma and other things that can be handled at the community level, patients had no access to their self-care groups where they usually sit and support themselves. We saw other challenges with delayed communication on continuity of services for NTD, and the amount of information that was available concerning COVID sometimes just served to confuse both patients and health workers. And so it was another challenge. Next slide, please. So it's not all challenges. Despite all these challenges, there are areas of intersection between leprosy control and COVID. The need for wash or access to wash facilities, the water, sanitation, and hygiene has been mentioned by the previous speakers. The mental health challenges that are faced by leprosy and NTD patients are also faced by COVID patients, and it has been reported. But also the need to engage the community, to develop responses that are truly community-based, that belong to the community and speak to the people that we are trying to offer services to, is another intersection between the NTDs and COVID. Next slide, please. Other areas of intersection are the need of a responsive health system. This has been talked about as well. That includes holistic approaches for NTDs, services for mental health, services for chronic care. We already are hearing of long COVID. When it comes to NTDs, we know a lot about disability management as well, and those patients are usually in chronic care. We need clear and timely communication and protocols for health system responses in the event of such health system stressors going forward and emergencies as these, and for NTD control as well. We've seen a lot of digital reporting, monitoring tools in response to COVID, and these are areas in which there is an intersection with the management of NTDs as well. How do we get to our patients even when we have stresses like the COVID-19 pandemic has caused? So opportunities therefore exist to take advantage of resources that are available for the management of COVID, and also to strengthen access to services within the health system. Final slide, please. I hope that's the final one so that I'm not running out of time. So in brief, I think we can take advantage of COVID-19 to achieve some of the things that are stipulated in the 2030 NTD roadmap. There's opportunities for intersectoral approaches. There's opportunities for digital solutions. There is integration into the mainstream health system, which is so important, and especially the call for universal health coverage for the most vulnerable in our society. And then the inclusion of communities in healthcare and in responses. In situations of stress, they can actually help us to define how we continue with care. Social protection and access to financial services is very key for NTD patients and other vulnerable groups in society. And so I think COVID-19 has illustrated the importance of the social determinants of health. There are poor living conditions, limited access to wash. NTD patients are already marginalized from the poorest of contexts and are not in a position usually to protect themselves, and the financial implications are also very dire for them. And so as I conclude, I think there is need to strengthen not only the resilience of the health system, but also the resilience of the communities affected by NTDs to better protect when we are faced with several crises in the health system. I thank you very much. I hope I have not gone over time.
Thank you very much, Dr. Irene, for this shedding light on the East African region, but I think many of the aspects that you brought up also apply to the rest of Africa and also to the other WHO areas where a lot of NTDs are still prevalent. It's probably everywhere the same, and I'm very happy for your two last slides to try to summarize some ways how we can take some chances, like more digitalization. I think we'll come back to that for the discussion. Thank you again. So our next speaker will be Mr. Mokoyi Bilagora from South Sudan. And he is, if you wish, the face of the national NTD program, since he is the national NTD coordinator. He also works with Christopher Blinden Mission, with CBM in South Sudan, and will bring to our attention the perspective from his country and how COVID affects the situation there. Please, Mr. McCoy, the stage is yours.
Thank you, Dr. Jim and colleagues. I think we can all appreciate the fact that the COVID-19 has hit hard countries with a very fragile health system. So maybe in the next slide, if you can just go straight to the slides. Can we go straight to the slides? Hello? Yes. Yes, so basically to appreciate how COVID-19 has impacted on the health system in South Sudan, we probably just need to share some background here. We are talking about a situation where 56% of the population are not accessed by the existing health system. So it means that you have this population relying mostly on the community-based structures that were mainly established to address issues related to population-based interventions for control, elimination of tropical diseases, and sometimes for vaccination and so forth. So with the COVID-19 situation and the restrictions that comes with it, you have a situation where basically this structure is rendered completely helpless. So if you go to the next slide, try to compare the system with the burden of disease that it has to deal with. So definitely you can realize that South Sudan is a boiling pot of most of the tropical diseases that are prioritized by the World Health Organization for control, elimination, and eradication. So you can see that the structures that have been built to address this disease are quite extensive, but these are structures that are really at the community level and loosely connected with the overall health system. So just for us to also to appreciate the structure of the health system in South Sudan, where you can see the stakeholders at different level, the national level, at the state level, at the county level, at the Payam level, and at the Boma level, which is the community level. It is important to appreciate the fact that when you look at the healthcare levels, going down to the lower first level healthcare delivery facilities, that's actually where it is even most vulnerable and very weak. And that's why the connection with the community-based structures was very, very critical to ensure that the basic services reaches those populations. So in the next slide, if we can move to the next slide, you will appreciate the fact that when the COVID-19 situation, the first case I think was detected, reported around March, and that comes already with the restrictions, the government advisory that followed, also advisory from the World Health Organization, and the suspension of most of the population-based interventions for NTD control and interventions. So at the time, you are actually talking about the structure that is to serve the 58% of the population, sort of like disconnected already, because even the former health systems already overwhelmed. We're having to respond to the COVID-19 situation. So the NTD department and the stakeholders started to think of outside the box, say, okay, what can we do? We need to be able to think of national guidelines to continue some level of interventions at the community level where you don't have the formal health system. Next, please. In the next slide. So maybe in the next slide, we'll try to see how some of the impact as a result of the advisory to suspend some activities, especially the population-based interventions. So the NDA's activities were suspended. That led, of course, to the issue of expiry of drugs, especially we have a big number of quantity of praziquantel and also some tablets of IVM, ivermectin, and also Zithromax expired. Also because of the COVID-19 situation, there was redirecting of resources to fight COVID-19, and also the repurposing of critical human resources that were meant for the NTD programs. They are now repurposed to tackle COVID-19. And of course, that had a bearing on the NTD programs. Next. So in the next slide, you will see a situation where the NTD stakeholders continue to think of better ways of how we can actually use the huge network of volunteers and community health workers that were originally built by the NTD programs to see how we can actually be able to contribute to raise awareness on COVID-19. And what the example we're sharing here is how we're able to develop very key awareness messages, put them, laminate them. One side talking about COVID-19, the other side talking about guinea worm awareness on the disease and the cash reward and the reporting and these enable us to be able to use the huge network of volunteers we have across the country to be able to also provide awareness on COVID-19. So this is just an example of how this network, this platform that is built for NTD control, elimination, can be utilized actually to respond to emerging health crises. Next, please. Now, it is very important that when we're talking about the NTD platform, I think this is a platform that understands well how to engage communities and recognizing the importance of engaging communities at the household, given the fact that with the restrictions, efforts were being made to try to avoid overcrowding at the community level. So I think the NTD platform has utilized the experience of engaging communities at the household level to ensure that to instill health-seeking behavior and also adapt behaviors that promote and maintains health, especially in the context of COVID-19. Next. Next, please. So maybe for us to be able to see, as we see in the next slide, the main structures that have been built, communities like this doesn't have, and there are many of these, doesn't have formal health service delivery facilities. And the only structures that you have in those communities are volunteers or community health workers that are part of the community. So those communities are mainly built to handle issues related to community-based surveillance and also provide some other community-based health interventions. And ideally, these structures have been used to provide very basic first aid interventions, has been able to provide community-based interventions, especially like NTDs. It was being used for immunization and also used effectively also for antenatal care. So again, we believe that in settings like this, you realize that the NTD platform is the only available system to fight COVID-19 in the majority of the population that could not reach the formal health system. Next. So if you see the next slide, you will also realize how extensive this community-based network. So this just depicts our 2020 plan for ONCO and LF interventions. And you realize that almost the whole country, especially with our engagement with the CBN through the different funding mechanisms, this is our plan area, how we intend to cover the different counties with the MDS between the coming period. And we believe that the structures we have in all these areas provide an opportunity actually to ensure that we can continue to sustain the necessary awareness messages to different communities on COVID-19. Next. Next, please. Yeah, so in the next slide, I think this is actually the final slide. What we basically want to emphasize here is the fact that definitely the COVID-19 situation have shown the vulnerability of the health system, especially in countries with a very fragile health system, and especially in our case of South Sudan, definitely that vulnerability has been really tested with the current situation of the COVID-19 pandemic. But I think also it has provided an opportunity to recognize the fact that the NTD platform in the country could be the only opportunity we have to be able to reach every population in the country with the necessary messaging related to COVID-19 prevention. And I believe that this is a platform that should be utilized to continue to address many other emerging health problems, especially in the context of the fact that the formal health system definitely struggle with ensuring that services reaches all populations. There are always population dynamics that limits the ability of the current health system to adapt quickly to provide services, especially when you're dealing with the populations where there are some level of community level fightings and insecurity situations. When you are dealing with a situation of very poor infrastructure like road infrastructure, you need to have a flexible system. And I believe that the NTD platform has the mechanisms to adapt and from such disruptions. So we believe that the NTD structures, the fight against NTD, not only will contribute to strengthen the system in the way of ensuring universal health coverage, but I believe that it is a structure that is very important to address emerging health problems. So I will end here, and I want to thank everyone for their attention, and I will be more than happy to respond to any other questions. So thank you.
Thank you very much, Mr. McCoy, for this overview, and also some other aspects, like some NTDs like guinea worm suddenly pop up from populations, animal populations where originally one hasn't thought about. This has been around for a couple of years and makes things more difficult than before, obviously. Yeah, I think for the sake of time, we just move on, and I hand over to Carsten for our last speaker.
Yeah, okay, thank you very much. Last but not least, I'm very happy to welcome Dr. Johannes Walz. Johannes is head of the Merck Schistosomiasis Elimination Program at the German science and technology company Merck. I think most of you will know. There, he is responsible for the placement of 250 million, tablets on praziquantel throughout sub-Saharan Africa and beyond. Next to it, he's also Director of Strategy and Finance of the Global Schistosomiasis Alliance and Chairman of the German Pharma Health Fund. He holds an MBA and MA from the University of London and a doctorate of law, so also a lawyer, welcome in our round, from the University of Vienna. So you see, he's a real European, and therefore he is also not on the continent at the moment, but on one of our European islands in UK. So Johannes, I'm very happy that you are with us now, and you will give a light on sub-Saharan African supply chain management in times of COVID-19. The floor is yours.
Thank you very much, Carsten, and thank you for that introduction. Yes, although I have a background here from Ethiopia, I sit in London, where the NTD agenda, certainly in the newly sort of established or re-established format DFID, is high on the agenda. Next slide, please. I wanted to give you a quick overview over the pharma perspective of the impact of COVID-19 on NTDs, and I will of course focus on PCT NTDs, preventive chemotherapy and transmission control, rather than the IDM, intensified disease management NTDs. The reason is simple. The large number and millions and millions, hundreds of millions of tablets, which are being delivered all over the world, in our case, focus sub-Saharan Africa. These deliveries have seen a sort of a real impact from the COVID-19 crisis, which all of us in this sector have to cope with. So let me give you a very quick overview of what we do in Merck in Schisto. A lot of the issues which I wanted to raise here have been mentioned already by Dr. Malecela, Dr. Burning, Dr. Ayakaka, and Mr. Logora. But let me nevertheless go right into the next slide, which looks at what we do in Merck on Schisto. We started to get involved in the fight against schistosomiasis, one of the unfortunately most established neglected tropical diseases in 2007, when we entered into our first partnership arrangement with the World Health Organization, which was then only last year renewed again. And we now, under our new arrangement, which in fact was already beefed up in 2012 as part of the London Declaration for Neglected Tropical Diseases, under this declaration and in partnership with the WHO, we deliver up to 250 million tablets of praziquantel, which is still the gold standard for the treatment of schisto. That's per year. So the total we reached until now is about 1.3 billion tablets, which translates into, yes, a sizable number of treatments. In our case, focused school-age children, about 520 million altogether. 2 years ago, we treated about 90 million, and this is the important thing here, into 47 sub-Saharan African countries. So our focus is sub-Saharan Africa. Next slide, please. However, what we do in Schisto, the investment in praziquantel means tablets, is the biggest sort of commitment which Merck makes as a company, but we do more than that when we fight schistosomiasis, and we have put together an integrated what we call a schisto elimination package, which consists of a number of elements, all of which are sort of, dare I say, really important in the global fight against schisto. As was mentioned, I'm heavily involved, and Merck is very much involved in the Global Schisto Alliance. We deal with and increasingly look at the issue of female genital schistosomiasis. Many of you might have heard that we are developing currently a pediatric formulation for praziquantel. But we also have additional molecules under development. We are involved in rapid diagnostic testing. We look at new ways to improve the Cato-CATS diagnostic tool, but we also involve ourselves in WASH measures and interventions and behavior change. And even the snails, yes, even the snails we try to address in a project where we look at gene editing. Next slide, please. So altogether, our endeavor and our investments and work together with partners, let me stress that, and also in the COVID-19 crisis, we are in one of many partners in this together. Our investments so far have yielded really quite promising results. You can see this here in a piece of work which the Swiss TPH will publish very soon, which looks at the population-adjusted risk of schisto in sub-Saharan Africa, which has gone down over the last 8-9 years substantially, 48% for hematobium and 36% for Manson-I. So the results are really promising. Next slide, please. Then came, of course, COVID-19. And Dr. Malecela already mentioned the London NTD modeling, the NTD modeling consortium has looked at the impact which COVID-19 has or could have on all NTDs, more or less, what the interruptions of treatments, etc., could have. For us in schisto, and this is what I point out here, the NTD modeling consortium came to the conclusion that the impact will be, yes, quite considerable. It depends on the duration. We can't currently be so sure how long the interruptions last, but it also depends on the starting point in respective countries, or rather the point when countries stopped treating as of March this year onwards, at which prevalence level they were at that time. And it depends on the type of distribution. I mean, which parts of the population particularly were or are affected by schisto. So it's not a sort of single straightforward result which the modeling consortium came to in the case of schisto, but it really depends on country, it depends on a variety of parameters. Next slide, please. This also applies in the same way for all PCT NTDs, the 5 of which are enlisted here. I won't go into detail, not only because I'm not a parasitologist or expert in this field, but also we don't have time. But here too, it depends on the prevalence levels. It depends on the time for how long these interruptions last. It was suggested that catch-up could be achieved in a number of NTDs by increasing treatments as soon as treatment rounds are resumed. That's from a pharma point of view, in principle, a positive sort of aspect. In practice, however, we deliver and have budgeted on annual basis, and it's not so straightforward. And that I think applies to most of us. We can't just double tablets next year. Next slide, please. I wanted to give you the idea, and it was mentioned, the PCT NTDs, it's 5 or 6 companies which focus on that. And I already said many hundreds of millions of tablets which are being delivered on an annual basis. Of course, in the case of the intensified disease management NTDs, Bayer or Novartis or Sanofi are very active. It's just that the quantities involved, the quantities of medicines are relatively, well, considerably smaller. Next slide, please. I'm reminded that I'm over time by my alarm clock. Next slide, please. As far as our elimination program is concerned, Dr. Malecela already mentioned what WHO was doing in terms of guidance. It was mentioned that countries stopped and restarted. For us, it's crucial that the reprioritization of shipments and the shipment resumption can reconvene as soon as possible. in principle, we were amongst the lucky ones insofar as our production plant was not affected by COVID-19. Same applies to our API suppliers, which is not a sort of self-evident thing, considering that the world is really supplied by China and India when it comes to API. Nevertheless, Dr. Malecela mentioned that we had serious warehouse issues on the one side, as well as logistics issues. Air freight, for example, or also sea freight is seriously affected during these COVID-19 times. Not only have prices gone up considerably, but also capacity has gone down. Next slide. And that, of course, makes it very difficult to deliver into countries. Nevertheless, from our point of view, as I said, production is on track. We have some delays, particularly when it comes to the clinical trials for the pediatric formulation. These are on hold currently. We also have a number of programs which we needed to postpone or delay at least. The bioequivalent study for our new formulation for conventional, let's call it, praziquantel, is delayed. And we also have a number of programs, as already mentioned, which will have sort of 6 months or more delays. Next slide, please. And I'm coming to the last point here. Just to recap, I think the impact of COVID-19 on this sort of community of partners in the context of NTD treatments and the fight against NTDs, the impact has been considerable. And there are so many players and so many stakeholders in this field, and they have so many different conditions to meet. Their own funders or funders themselves. It's not us as pharma companies, but also, as I said, the implementers, the research world. There has been serious impact. So for us at Merck, we want to come back, and we are on a very good track here to resume regular deliveries of our NTD drug, means praziquantel, as soon as possible. We will take away, and that's one of the things we have to take away, learnings from the COVID-19 crisis, also on the mechanics, let's call it, of the supply chain. We will hopefully restart the clinical trial for the pediatric formulation very soon, and the other projects which are right across a number of countries. Dr. Malecela mentioned it, and I want to repeat this really. The roadmap will be our sort of guiding light for the next 10 years. And we will use the roadmap as we reconvene MDAs and treatment, and from our point of view, deliveries of praziquantel into countries with the help of this new WHO roadmap. Thank you very much.
So thank you very much, Johannes, for your nice overview. And now we have 3:10. And this session has to be closed very sharp. So 20 minutes or 90 minutes and 30 seconds are left. So we already got some questions, and maybe we start with the first one. This is directed to Muele. Muele, are you still there? I hope so. Jan Imisch, he's head of the Christopher Blinden Mission Berlin office and Venro's spokesperson on One Health, not One Health. So I'm biased by the presentation of Constanze. Wanted to know, WHO just very recently published its guide on the mental health of people affected by NTDs. Mm-hmm. It called for a person-centered approach. Where do you see major challenges to implement this approach, specifically in times of COVID-19?
Absolutely, thank you. That's an excellent question, because this is the time when COVID...
Well, did you get this question?
I did, and I'm answering it. Can you hear me?
Yeah.
Can you hear me? Can you hear me?
So I think at least
can hear me.
I can hear you.
Everyone can hear me? Okay. Yes, so I'm saying that's a really good question, because at this time of COVID-19, as we know, there's so many things, the social distancing, the kind of almost isolation it's impacting more people who already have these stigmatizing NTDs. So it's a really kind of catch-22 situation. But the most important thing is to still find ways to reach out to people. So while there is this, because it is the person-to-person communication, whether we do it by physical means and social distancing, whether we try and use digital means to keep people aware and informed about about their situation, or getting some way to work with communities to support people's mental health. All these things are important at this time when COVID is really pushing back and is kind of forcing isolation. So the stigma tends to increase, like Irene's presentation. We see the stigma increases, I'm looking for the right word, but all the manifestations around stigma and mental health in general tend to increase just because of the situation that we already have. So with NTDs, that becomes more of a critical problem, but it has to be, we have to address it. And so the problems that I see with COVID is just the sheer focus, first of all, of the health system. There is no, the health system is bogged with so many other things. So, here is where really community support, community practices, patient groups can really help support and change the dynamic, particularly when we're talking about mental health, at least as a start. And then we can start thinking about other things. But it's very important because these are people already traumatized by their condition. And so this just creates more of a problem. So I think we need to look for kind of community solutions, local solutions that will help address mental health in these areas.
Yeah, thank you very much. I have just a question related to that, but that you may answer or others may answer from their perspectives. How much can digitalization, speak of mobile phone surveillance tools, help to reduce this isolation, since there is the distancing, obviously? And what have you gotten some feedback from countries or from your own perspectives on the ground that this is something that is now increasingly being used to compensate for the otherwise social distancing that is in place?
Okay, is that to me?
Yes, please start.
Okay, yes. I mean, I think that there's been a lot of use of digital technology mainly for the MDAs, but more and more also to look for patients, but less for patient support, more to look for where the patients are. So I think taking this another level, ensuring that we use it because we have used it to track patients. So we can adapt it to start saying, how are patients feeling? Can they give us feedback on the situation for the day and things like that? I think that's a stage forward from what we have already been using the tools for. And in Madagascar, for example, they have been using a lot of digital technology. And I think there are a number of other countries who have also done the same, but I think more linked to the MDA. But we have to now focus. I know that in many countries, they've also used them for patient tracking. But now we have to use them, we have to think about patient tracking as well as patient support. How can we make that be a tool for patient support as well as tracking? Thank you.
Yeah, thank you very much. I think this is important, and maybe also a way forward that may accelerate now with all that. I think the next set of
maybe Achim, if I may just very quickly add, from our point of view, digitalization is absolutely crucial in the context of tablet medicine deliveries, but also to bring these various capabilities or the possibilities which digitalization brings to us in the context of NTDs, to bring them together. We can't overburden countries and stakeholders or users with the pilots after pilots of digital tools, but we have to find this commonalities and see exactly what Dr. Malecela said in the context of patient care, but also bring it together, because it's NTD departments which will deal with that, bring it together with the mechanics of the delivery of tablets.
Thank you. I think this is a very important aspect, and obviously you are at the core of it all, trying to get the delivery of praziquantel. I later have another question about expiry issues, but we only can get to that if we have answered the other questions. And there is a set of questions raised by Dr. Sabine Specht, head of clinical filariasis at DNDi. And the question goes around how are the financial gaps now being addressed? Can Germany do something? And how can the recent advances in collaborative efforts during the pandemic crisis be maintained? And is there a prioritization necessary, or is it more or less postponing activities, and where would we have to prioritize other new funding? I think this was addressed to Mwele and all. So who wants to answer?
Okay, I can start and then people can take off. I think the most important thing right now is to support countries that are resuming their MDAs. I think that's the key. And I think the support can come in many ways. First of all, understanding better their mitigation factors. What do they need to do? How do they do it? What are the kind of tools that can be used? How can we use digital technology to improve it? What are the better ways of delivery? What are the better ways of patient care? And such. And I think for those mitigating measures and for the precautionary measures, there's going to be added investment needed. Because for example, all the plans are based on delivering, going house to house or face to face, or going in a group and delivering interventions. Now you have to have PPE, you have to have all these other things. So that's an added investment into the process. So there will be that. So support for these mitigation measures, operational support for operational research, for example, as well, for some of the ideas or strategies that will need to be done. For example, if we're talking about how can we do remedial strategies if we are late by 1 year? What are those remedial strategies? I think there's a room for operational research as well. So the investment on research there is also critical. So I know that's music to your ears, Akim, but it's true. We do need operational research for that as well. So I think as a start, those are some areas where I think investments are heavily needed, and in order for us to move forward in a productive way. Thank you.
Thank you. Are there other comments from the other speakers on that?
Yes.
Go ahead.
If I may speak. Yeah, thank you. And I want to echo that, yes, there's a major investment needed, but maybe again to look at what positive developments maybe have already occurred. And I can speak for the German context. The German Federal Ministry for Economic Cooperation and Development, an important ministry for our work, they have just introduced a subdivision of pandemic prevention and One Health. And with that usually comes a lot of funding or increase in funding in areas where they want to set a focus on. And I know that the GIZ, the major federal implementing agency in development cooperation, also increasing their operational capacities in One Health, and with that comes also NTD as a focus. And just last Thursday, again, this ministry has launched the One Health Research, Education and Outreach Center in East Africa, ORECA, it's called. And one of the programmatic pillars there also is neglected zoonotic diseases and food safety, both very relevant for NTDs, of course, the other one, emerging infectious diseases and AMR. So also there is money going, and it focuses on research and outreach at the same time. So these are positive developments, and I mean, it remains to see if there's really an increase in funding and increase in collaboration happening, but I think they're good signs, and I would like to remain hopeful there and see what this is going to lead to.
Yeah, I think thank you is a very important comment, since the One Health program is sort of an extra program at the BMZ, and this was definitely getting more support and more push because of the COVID-19 crisis, since COVID is, if you wish, the example of a One Health issue. So I think for the next questions, I'll hand over to Carsten again.
Achim, yeah, there's a second question from Sabine to Muele and all of you, asking how are countries coping with the additional burden? Field of human resources, consumables for MDA monitoring and morbidity management on the one hand side, and no, at the same time, now implementing all measures related to the COVID situation. And then a very specific question I like, what could the German government through its programs do to help if help is needed? So the first question is help needed? And which is to the government so it's your chance now. Take it up.
I think you were frozen for a second. Maybe you repeat your second question, Carsten.
Okay. This is, sorry, from the southern part of Germany, remote area here, so for neglected people. The question was, if help is needed, if you have to fight against NTDs and to fight against COVID in the countries, and if help is needed, what can the German government do to help? So maybe you have ideas, and maybe the government is listening so that you can address directly your wishes to them.
And the question is directed to?
Muele, just start.
Oh, okay, thank you. Thank you. So I think the response is very much what I responded to the earlier question, that the key thing here is to support countries to get through these mitigation measures, because otherwise we will not make progress. And I think supporting the countries getting through the mitigation measures, and then I think the other thing is to support. And here I don't want to be selfish, but I really think that the roadmap, supporting the activities of the roadmap, is a really good step in the right direction, because again, we focus on integration, we focus on multisectoral action, we focus on mainstreaming into the health system. All these things, which if you look at the German government policy, definitely is focusing on those things. So I think focusing on them at the country level and ensuring that we're able to deliver these NTDs at the country through this support at the country level. So in practical terms, it's first of all supporting the areas around mitigation and precautionary measures so that the current MDAs can take place. But in a more medium to long term, it's supporting activities of the roadmap within the countries so that countries can deliver and have have sustainable programs.
Yeah, thank you very much. I think that that is something that is definitely being picked up, I guess, and we, if not, then we can also reiterate it in our consultations. And I know that there are some considerations to set up more programs for regional support, maybe over countries, like in certain areas of the continent. So let's hope that this is taking speed and that it will definitely help to mitigate things. So there is one other question that we have not raised yet in our presentations, and this is by Julia Groß to Irene Ayakaka, but I think it may also relate to the others, other speakers. How would you describe the situation concerning access to COVID testing in the areas you work with? So what is the numbers that are coming from there? And
Please, a short question, only 2.5 minutes left.
All right, so just very quickly, in the areas where we work, COVID testing has been extremely limited. That is just a fact. So, for example, in Uganda, I think we have had a total of just over close to 540,000 tests since testing began in early March. And this is for a population of 46 million. And so it is about 11,000 tests per a million population. And that number, I think Ethiopia has about 12,000 tests per million population. So still very low. But also reflected in the number of COVID cases that have been reported. The total number, I think it's about 11,000 in Uganda now. And Ethiopia might be around maybe 93, just over 93,000. Tanzania, we wouldn't know because Tanzania reacted a little differently to COVID, and the reporting was stopped very early on. But yes, just to reiterate that practically, without a holistic approach to the management of NTDs, for the previous questions, and trying to integrate them into the whole the health system and across to the communities, I think it would be hard to imagine that we would have better practical steps to encourage ownership of the NTD program from the countries. So it goes back to the issue of integration into the health system, the countries really owning up to integrate the different aspects of NTD management. Thank you.
Thank you. Do we have time for a final one?
Oh, no more. 50 seconds left.
Okay. Practical steps that can be taken to encourage endemic country leadership and ownership of programs. I think something has already been answered, and the question goes to Dr. Mele and Dr. Irene. So maybe some final words to that.
No, Akim, it's only 20 seconds left. We cannot do it. We just
are we being cut off?
Yeah, they are cutting off. Thank you very much, everyone. First to the presenters and also to all listeners and participants. And hopefully my wish is that we can meet next year again physically in Berlin. Thank you so much. Take care, stay healthy, and make sure that all the others can stay healthy. So thank you very much. All the best. Bye-bye.
Yeah, same for me. Thank you very much.